I really have the honor to introduce Cheryl Treadwell, who is the branch chief of the Safety Prevention and Early Intervention branch of the California Department of Social Services. So I will go ahead and hand this over to Cheryl.
Thank you very much, Lydia. Good morning, everyone. Glad to have you here. Excited about the day. I'm hoping that you will walk away with some beginning tools and things that you need to move forward with this prevention work. I just want to thank all of the folks in the room. The day is meant to sort of orient the participants on the different pieces of what we've been doing around FFPSA, Families First Prevention Act, the state's program, the block grant, comprehensive prevention planning, how that works together, how that gets connected so that you can, if you haven't already started, then, this will give you some ground level of impetus to begin your work. So our whole idea is to invest in you in many ways to support you as much as we can, but we want you to invest in being intentional in your coordinated effort. And just by the fact that we have a broad variety of folks on this call is just a really good indicator that that it is what we are intending to see, that we like to see that level of participation and variety. Strong communities make strong families. We're really talking about moving this prevention work further upstream. And if we don't know how the children are doing, then how can we do the work that we're doing? We want our kids to be safe and well. So could you go to the next slide, please? The next slide. So how are we going to achieve this vision? When you think about how you imagine this, California envisions a prevention program that serves families. They're able to get the necessary supports and services that they need so that they can stay in their communities. And we create what we call nurturing environments. Try to imagine what a community will look like where they're able to go in any place in their community, whether it's a resource center or a community center or even hospitals, so that you could go in and get the kind of needs and you get screened for those kind of supports and services. So we're looking for an integrated statewide system that supports families. And I'll talk a little bit more about the equity lens, but this is our vision to strengthen families in their communities. And I can't say that enough. I always try to quote our federal Commissioner Aisha Schomburg. She says we should envision a state of mind or a state of environment where a loving approach to helping children to attain what they need so that they live with dignity by comprehensively supporting their families and through a collaborative network. And it's based on those carefully selected resources that are effective as a result of public and private investment grounded in your community, in your community's culture, and having a workforce that is fully devoted to serving with intentional equity. So I know that was a lot, but I think that is just really where we're trying to get with this work. Next slide, please. So we always talk about this mind shift and how do you think about achieving this vision. Shifting the mindset so that we're not reactive all the time. Let's be proactive and be on the offense and not on the defense, and making sure that services attend to the things that people need, the conditions of where they live, grow, as they say, the social determinants of health. It's the community, it's the neighborhood where they live. If they don't have places to eat, they don't have good health care, if they don't have ways to minimize the violence in their community, all that contributes to their well-being. So from prevention to well-being overall. And then looking at how we engage our community. We say that symbolically a lot, but really making that culture shift requires a willingness to do the work. It's meaningful for people to have positive outcomes and to be able to live, as I said, in the community in good living conditions. Conditions. You and I want those same things. Why shouldn't the communities that surround us, or that we support, or that we drive through, whatever those neighborhoods are, they should have the same things when we talk about good living conditions. And so, to the extent that we can play a role in that, and we meaning all of the cross sector populations to do that, that is sort of the impetus of the work that we're intending to lift. And making sure that that lived experience voice can find a place in the planning and in this work is important, because communities know what they need and they will happily tell us. We just have to be willing to listen and be willing to be actionable for what is being shared with us. Next slide, please. You've seen this before. I won't spend a lot of time here, but it's important to understand what the levels of prevention that we're basically talking about. Starting at the base of the tier, you think about primary. That's your general population that we're trying to reach. When you see a lot of the public campaigns to talk about preventing child maltreatment, that's your primary prevention. And then you look at secondary, those are services and strategies when the family or the child are beginning to present with risk factors. And then tertiary is once there has been child maltreatment, of course, then services are then put in place. And that's where child welfare is footprinted, is in that tertiary level. And with the prevention world, we're trying to move further upstream. But when kids do come into the system, we do want to make sure that we can make a difference and that we're not a hindrance. Next slide, please. So once again, this continues the theme. So how do we plan on doing it? We're implementing a comprehensive continuum of services, and we have a framework built on those three tiers. We want to expand the services, what we're already doing. So think about what you're already doing. If you had an opportunity to expand that, what would that look like in your community? And how would you bring those services to bear to the table? How would you discuss that in your community? How do you engage your community? And we know that that is a challenge. That structurally, when you think about government, you don't think about government as an engaging entity. So, suspicious folks in the community might say, "Oh, the government wants to engage with us. What does that mean?" So this is really making sure that you are really thinking about how you engage your community. What does that look like? And then increasing your capacity to integrate. We use that word, we use that concept a lot, and we realize that it's a lot to bring folks together to do an integrated approach. But you have to be willing to do the work and put in the time. And I'm thinking the tools that we, over the next 2 or 3 days here, are presenting to you and giving you an opportunity to think that through will result in the kinds of things that you need to do to engage your community and come up with a really good prevention plan. And then providing those holistic models of care, whole child, whole family, the whole community approach. I mean, that's a concept that's been around for a while. And I think for child welfare, I think it's good to hear that we are taking on that sort of whole family concept and not separating families. Even though our emphasis, you always hear us say child and family, a child is part of the family, right? So it's the whole family, whatever that's defined as, that's what we need to be focusing on. And a lot of this framework is built in an ACL that we developed, ACL 2223. I'll have them place that in the chat. And throughout the presentation, there is references to that ACL for different parts of this presentation. Next slide, please. And as I also said, all of this must be done with an equity lens of diversity and inclusion. We must thread equity in all of the areas of our systems work, program work, practice work, at all levels is crucial to benefiting the communities that we serve and those that are disproportionately impacted that have experienced multi-generational systemic racism. You know, this time 2 years ago, this was very, very emotionally on everybody's mind when you think about the whole George Floyd incident. And here we are 2 years later, and you wonder if folks still have that passion to really put in the work now that the emotion is still there giving the environment, but people really still need to understand that the structural racism pieces and upending those pieces are work that is necessary for this as well. So we must honor those voices, even if we risk the opportunity of not necessarily liking what we hear. That is not the purpose. The purpose is to reflect their perspective, reflect the perspective of the communities that are being impacted. And families can tell you what they want. Communities can tell you what they want. They know what prevention looks like from their perspective. It is important for us to make sure that as part of this prevention planning, that we consider those voices and thread it so that we can have meaningful impact for all types of families. We must unify equity around avoiding family separation as much as possible. And not just when you think about that being a unifying force, it is not just in child welfare. We've seen it in the whole refugee community world. Keeping families together is a unifying voice. And recognizing out there that there are culturally responsive services, whether or not well supported on the evidence-based practice rating. However, we're going to work to understand how we might move those higher up on the level because of the EPP level. So that is more the work that the department is going to be working with counties to do. Make sure you have a good governance structure. Make sure relationships are strong and important. And I like to highlight the relationships, especially with your tribes in your communities. Very, very critical. Being able to engage in meaningful conversation and consultation are missing pieces. We must continue to fill those gaps. Can't reimagine this system, like I said, unless you address the structural racism, be able to adapt and practice what we call our integrated core practice model. Uh, Families must be able to experience the community, the engagement with our system the same way. That's what our practice model is. So in our community, in our prevention fan, we have a community pathway. I think that's very promising. And I'm looking forward to seeing where that help is needed to shape a really robust and supportive community pathway. I believe that is all of my presentation, and I will pass it on to Stuart. Thank you for your time this morning.
Good morning. I am going to do a little bit of retrospective history, give you a little feeling for what's been going on. It's so wonderful to hear about the vision and where we're all headed with prevention. Give you a little bit of background on some collaborative work that's been going on. So for the last, and Cheryl just mentioned the integrated core practice model. For the last 10 years, our organization, Child and Family Policy Institute of California, has been facilitating the development of the child welfare core practice model, which is the foundation on which the integrated core practice model was launched. And as we were doing that work in 2017, our organization was challenged by the County Welfare Directors Association to broaden our focus to embrace prevention. In 2018, based on that, the Child and Family Enrichment Cabinet, we originally called the Prevention Cabinet, was formed as a partnership between County Welfare Directors Association, the Office of Child Abuse Prevention, the Child Abuse Prevention Center, and Strategies TA. We developed a mission to inspire and support each California county to develop an integrated system to support families in providing safe, stable, nurturing relationships and environments for their children. With that mission in mind, we tried to figure out how do we get this work going at the local level. So in 2019, we hosted on January 31st and February 1st a prevention summit in San Diego. We invited counties to apply. We thought maybe we'd get 10, 11 counties. Well, it turned out that 36 counties were interested in launching this work at the local level. Unfortunately, we only had capacity for 22, but those 22 attended. They were convened by child welfare and CAPC co-hosts to bring those teams together to develop action plans for moving forward. And those counties have moved forward. We brought them together again later that year. And then next slide. Between 2019 and 2022, Strategies TA and OCAP have been we're working with counties, designated counties, to strengthen their local planning efforts. So a lot of stuff's been going on the ground at the county level. A year ago, in 2021, we had the second Prevention Planning Summit. Due to COVID, it was virtual, but again, inspiring teams to strengthen communities. We were able to bring additional counties on board and to support and expand collaboration in promoting healthy, strong, and resilient children, families, and communities to increase positive outcomes by inspiring local teams to embrace the purpose and shared mission of the work, providing safe space for creativity, increasing connection within and among teams, and celebrating continuity. So all of this work is culminating in the work that we're here to talk about today, which is merging previous planning work with the FFPS planning to support comprehensive prevention planning. A little bit of that sort of overview background, and then I'm going to turn it over to Troy Nichols from Strategy TA to tell you a little bit about what Strategies has been doing to support counties in their prevention efforts. So Troy, take it away.
Definitely. Thank you, Stuart, and thank you, Cheryl, for those inspiring words getting us started this morning. First, I'd like to point out on the right side our values, our core values, and how they have already been spoken about by both Stuart and Cheryl, and they're woven into this whole process and what we do. And we came up with these long before we knew what an FFPSA was. So it shows you the marriage and the collaboration that's already occurring. I'm going to take you just for a moment through our mission and some of the things that we've been doing to assist this process. We support cross-sector networks throughout California, and we advance community-driven action to help strengthen communities. And I like that Cheryl pointed out that it's not just our children, it's not just our families, it's communities. Sometimes in the work that we're doing, we have folks concentrating on just the counties, not realizing, again, there's a community that has to come to action. We work with child welfare systems and child abuse prevention councils to build the county and statewide coordinated, comprehensive, and integrated networks. This technical assistance is throughout the state, and it's to help with long-term solutions, right? We don't want this to be a short-term fix. We want longevity and sustainability. And both the Child Abuse Prevention Center of Sacramento and Children's Bureau of Southern California, we co-lead this effort. So just a few of the things that we've done over these past 2 years in supporting the counties and these county prevention teams who are very elaborate and have quite a few folks at the table that are helping with this process. So we're currently working with 29 counties. And the consulting that we provide, we've put into categories. So these are our actual categories that we use to document our work, providing subject matter expertise and product development, process consulting, like how do we get through this process together, leadership coaching also, information gathering, facilitation, and group capacity building. And one that's overarching that we don't have as necessarily a service, but we have to do it is our relationship building, right? Developing our relationships and making them cohesive so that we can get this work done. And we also support counties in the development of this implementation of the comprehensive evidence-based child abuse prevention plan. So it's a huge aspect. And again, like you to see all the threads that are running through both Cheryl's and Stuart's presentations coming to the mission and vision that we have as well. Next slide. So why should we collaborate? Well, it's the only way that this work can get done. We have to have everybody at the table, right? And ensures that we're working together collectively, that collective impact model and mentality, so that we can help these conditions that lead to reduction of child abuse and neglect in our communities. Again, that community word, right? I often encounter folks who feel like this is not me or part of me. Well, your kids may be going to school with somebody that's affected by this. And so it's about community. I want to keep that in mind. Broader understanding of strengths and needs in the local community. So a strengths-based approach, making sure we understand that, there are great things going on within the worst communities, the communities that are most challenged. So we have to find those strengths, build on them, and continue to add more. Including the voice of that lived experience and lived expertise in developing programs and services. We can't do it without talking to the people, without having the people at the table, inviting them to the table, but also maintaining them at the table, not just inviting them. Representation isn't enough. We have to have inclusion. Establishing an ongoing alignment and coordination. So there's that ongoing concept again. We want sustainability in this work. We don't want to throw all of this time, effort, and money to this and it not be something that's sustainable throughout the years to help our communities. Next slide. And this is just a list of the cross-sector partners. So the required partners based on the ACL are on the left, but the recommended partners, I'm going to say, are just as important to bring to the table, to have to the table. I work with quite a few of our counties in making sure our faith-based communities, because often they're a fixture in our county and they're on this list as well. So take a look at this and just have in your minds that community and community efforts and collaboration is the only way we're going to get this work done, and Strategies TA is at the base of it. So I'd like to reintroduce Cheryl Treadwell, our branch chief, to take us through some of the comprehensive prevention planning information. Thank you.
Okay, thank you, Troy. That was great. So I'm going to talk a little bit about the different pieces here that I mentioned earlier about FFPSA. So the Families First Prevention Act was passed in 2018. It provided a new option for states and tribes to finally use what we call 4E entitlement funds for evidence-based prevention and trauma-informed services for children and youth. And we use the word deemed candidates. That basically means that these are children who are identified at risk for entering foster care. So this is the first time that we've been able to use money that normally is used for placement for services. And not only just plain services, but services that fall in these three categories. They are either in-home parent skill-based programs, mental health services, and substance abuse prevention and treatment services. But they must be evidence-based prevention. And as you know, there is a clearinghouse that the feds operate, and so those evidence-based interventions must be on that registry. It's intended, as we've been talking about, to reduce the entries into foster care by moving upstream and using funds for prevention services and interventions that will reduce the risk factors. Next slide, please. So that was the federal program. So our state program is California's Families First Prevention Services Program. Of course, it doesn't help us the fact that we decided to name it the same as the federal program, and I know that has been confusing to people, but what is the connection between the two? What our prevention program does is it leverages the current prevention efforts that many of you have already started in your community, and it reaches a broader audience than what the feds require. And our whole idea is to reach families sooner by looking more at the primary aspect and secondary than some of the tertiary aspects of prevention. We build into our program a comprehensive plan requirement, and we also making sure that counties in their comprehensive prevention plan are doing culturally appropriate and responsive services, tailored. It has to have a cross-sector approach. All of the things that we've been talking about previously that involves all of the entities that are required for this to be successful. That's your collaborative approach. We also meet the minimum federal requirements of FFPSA Part 1. And then for our state program, as I said, we go beyond what the feds require. Now, I want to say this. A lot of people, when FFPSA first came out for Part 1, it's like, wow, prevention, we get to do a lot. Realize this, that the federal program may be well intended, but it tends to be a lot more restrictive if you really get into the details. It is not a door that you can drive a truck through. It's an opportunity and should be considered a tool in your toolbox for building a comprehensive prevention continuum of care. And that is what the state program does. And so that's the difference. We're trying to get people to stop hanging their hat all on the federal program. And I'm not condemning the program. I just want to make it clear that there are some restrictions with the federal program that does not allow us to do some of the things that we like to do to build a really strong, comprehensive prevention system. So go to the next slide. So here's a comparison, as you can see here. As I said, and I won't repeat as much as I just mentioned, is that on FFPSA Part 1, you have to meet a candidacy criteria defined. And we put that in California's prevention plan. You have to be either at risk, imminent risk for placement in foster care. And then we have a list of candidacy populations that we have put into our plan that really, I think, are expansive and creates a universe of eligibility for folks. Then it also applies to pregnant and parenting foster youth. As I said, we are available for EBPs only. And in our state FFPSA program, you have flexible funding for all three levels, primary, secondary, and tertiary. That is a difference from the federal program. You can support any target population with the goal of preventing child maltreatment. And then the funds that we have provided can be used for direct services, or it can be used to develop your infrastructure for prevention services. They are not restricted to just funding the 10 evidence-based, well-supported practices that are in California's current plan. That you can use the state funding to fund other services as long as they're preventing maltreatment. Next slide, please. So this is just another way to depict the comprehensive prevention plan. Basically, your state program, in accordance to what we put in the statute, which is cited here, you have to opt into the program and you have to submit your comprehensive prevention plan to the state. And once again, it should cover all of these, it could cover all of these tiers and levels of primary, secondary, and tertiary prevention. As you see, tertiary, that encompasses the FFPSA Part 1. So that's really closer to what we do now when you think about your family maintenance systems, kids already with open cases in child welfare. That is really where some of the money is being targeted for FFPSA requirements. So you must include that in your plan when you opt in. You must make sure that you are at least addressing the tertiary prevention strategies in your plan in order to receive the block grant money. You can't just take the block grant money and not talk about Part 1 requirements. So that's how the two are linked together. Next slide, please. Here's just another way to show the puzzle pieces. So these are the components. You have FFPSA. They require us to have a 5-year prevention plan. And so we enacted a statute that provides flexible funding so that you can develop your local comprehensive prevention plan. And that's your block grant. And voila, you have your Families First Prevention Services Program. So we try to do our best of threading all of the elements together, and the hope is that it comes together in your comprehensive prevention plan in one document. Next slide, please. You've seen this slide before. Some of you have, maybe not. This just shows the roadmap, and you can drop in the chat the picture of this roadmap here. It just basically explains what we had envisioned, and basically just to start with some foundational guidance. A lot of you have participated in our reimagining series and webinars on community engagement. We started that series, and you move through this continuum to start building your capacity and your readiness. If you note in the slide where the red pieces are the lollipops, as we call them, that's where the key pieces: capacity building, asset mapping, opt-in, do your readiness work, decide what your target populations are going to be, uh, go through this planning process so that you result in a prevention plan, and then be prepared to deliver services. And as a result of this, our job is to provide that kind of support to you, and we have brought together a team of folks to provide capacity and readiness assessment supports to you, in addition to what many of you are probably already doing in your counties. Next slide, please. So what funding can be leveraged? You have a lot of funding sources, or many of the funding sources that are already in your coffers. You have your Family First Transition Act funds, your Promoting Safe and Stable Families. You have your State Prevention Block Grant money. And then most recently, we have disseminated your community-based child abuse prevention funds, which we refer to as CPCAP. And then the American Rescue Plan Act issued additional CPCAP funding that was to be used for primary and secondary populations. FFPSA Part 1, as I said, is for individuals qualifying based on candidacy. So together, all of these funding sources can be leveraged to create that continuum of prevention services, which is indicated by the arrow on the bottom. So basically, I think California is well off in the sense that we have enough investments to really direct the resources, I would say in my state career, to really be thoughtful and meaningful about how you plan for the services, that you are funded to do that. And I know folks are probably like, well, how does all this work, and how is all this going to come together? There's work and there's support for that as well. But I also encourage you to not overthink this. If you're already doing this work, how would you expand, and what do you need to expand to, and what communities are you missing? I mean, it really requires you to sort of do that reassessment and really just target these funds in a very meaningful and thoughtful way. And don't make it complicated, as I said. Just listen to what folks need. Keep it simple in that regard. And just sometimes I think there's a perceived barrier of we can't do this with the funding. But I think with the state funds, they're pretty flexible. We are pretty clear in our letter what was allowable. The letter that was previously dropped in the chat has the information with what are some of the allowable activities.